Thanks very much for the invitation. I need to thank Rudolph for that initially, but so yeah, I have an interest in Rumen fluke. I wouldn't claim to be an expert on surveillance, but just a little bit of background as to what they are. They're digenean or two-host trematode flatworm parasites. They're technically called paramphistomes, hence the clinical signs being classed as paramphistomosis. There's a very nice life cycle there from Animal Health Ireland. It's very similar to liver fluke, and I'll come back to that a little bit later. And we're finding out more about it as we go. They're characterized by the possession of this large posterior sucker. So the EM scanning image at the bottom left, the big sucker on the left is what they hold onto the surface of the rumen with, and the mouth is actually the sort of fluorescent green bit on the right. So there's a beautiful image, H&E there. I think it was Sandra Scholes at APHA published initially in the Vet Record. I think somebody said there's a lovely picture of a rumen fluke taking a big bite out of the rumen wall, but it's actually that's the acetabulum holding on. So at least we know which way up they go now. But they're very common in the tropics and increasingly common here. And just to mention the tropics, they are so common that they're actually used as a foodstuff. So when we're talking about novel protein sources, here's one. So you can go down to your local abattoir and buy a rumen, wash it in the local grubby river, take a big handful of rumen fluke off the surface and stir fry them. So that's maybe something I can do when I retire. But just to say a wee bit about the story so far, they've been around for quite a while. There was a lovely report back in the 1950s from the University of Glasgow describing what was found on the stomach lining of an Irish and a Scottish cow. So, and they came up with the name Paramphistomum scottii and hibernii to classify them. But it turns out that they're actually synonyms of Paramphistomum cervi, which is the species that they were thought to be. A wildlife parasite that we thought spilled over into livestock. They were thought to be relatively non-pathogenic and taught as such. I should really mention the image at the bottom right. This is a pencil drawing of how the species identification was arrived at. So just shows the sort of skill set of people at the time in the 1950s. I certainly couldn't identify rumen fluke like that. But they were thought and taught to be relatively non-pathogenic, and I think that's still the case, and we'll come back to that. Even in illustrious vet schools like Glasgow, they were taught as non-pathogens, as sort of incidental findings. They're also thought to cycle through aquatic or planorbid sort of ram's horn snails. They were associated with infection at the margins of flooding events. So that was the kind of perceived wisdom at the time. But I think that's slowly changing too. I mean, one thing to say in relation to surveillance, we don't do any active surveillance as such. I mean, for example, we don't look in the abattoir really because it's in the rumen, and the rumen goes off somewhere else to be made into tripe or whatever, and that's almost how we found these by accident. So it's unlike liver fluke, you don't have animals on the line being inspected by the meat and hygiene service for that. But eggs started to appear in fecal egg count samples from about the 2000s onwards. It was reported by Foster et al. In 2008. I'm not sure, is that the same Foster? Aidan is on the call, I can't remember. But the eggs actually look very similar to liver fluke eggs. So the image on the right is the little gold egg is a liver fluke egg, but all the clear ones around it are actually rumen fluke eggs. So it comes out in the same sedimentation test that we do. And up until about 2012, I'm reliably informed by Rudolph that they were all just kind of counted as fluke eggs, but started to discriminate from 2012 onwards. And now the testing labs are real experts at discriminating between the two, and they're recorded separately. And we'll come on to that in a little minute. But also with the advent of coproantigen testing for liver fluke, so the coproantigen ELISA, Bob Hanna there you might recognise from AFBI Northern Ireland did a very nice study looking to see did the liver fluke coproantigen test cross-react with rumen fluke, and it didn't. The only thing they got wrong was the species of the rumen fluke they were talking about, but I'll explain how we worked that out. So what's changed? Well, I mean, fluke kind of got a second wind about 2012 and 2013. We had a very wet summer followed by a very mild winter, and ended up with a perfect storm, including severe fluke cases even on the east coast of Scotland. So there's lots of acute and chronic fluke out there. So it was really good fluky weather. And that's when we started to see reports of clinical paramphistomosis, rumen fluke disease in both sheep and cattle. So that was Colin Mason in Dumfries and Galloway and Macmillan down near Bristol. In fact, the image of the calf is one of Macmillan's published off the paper in the vet record, a very emaciated looking young calf with a very inflamed, angry looking intestine. And when they washed the intestine out, they found thousands and thousands of baby liver fluke. So that just reinforces that the adults at the top there, those little pomegranate seeds, if you like, I need to stop referring to parasites as foodstuffs, but they're relatively well tolerated on the surface of the rumen, although they're not there for nothing. But clinical disease is invariably associated with large numbers of immature rumen fluke in the intestine. And that's an important distinction. And just to keep the story going, this is a report from UCD in Dublin. I'm trying to see what date that is. Is it 2017? Yes, so just it hasn't kind of gone away. This was actually a vaccine trial for a liver fluke vaccine. The animals got very high dose of rumen fluke immatures and caused clinical disease. This is James O'Shaughnessy, and they went to the trouble of trying to count the actual cysts on the grass that the animals might have been eating. And they reckoned that each individual animal was eating about 5,000 rumen fluke cysts a day for a period of 3 weeks. So you can imagine the sort of acute rumen fluke burden in those animals. But it begs the question, how important is rumen fluke? And that, from experience, that really depends who you ask. Acute paramphimosis that we've described is characterized by bloody diarrhea, weight loss, and anorexia, but it's thankfully very rare and still very rare. There are no reports of chronic infection associated with the adult disease in the UK or Europe. And actually, there's very little or no published evidence of production impacts either. And there's a recent study done by Queen's University in Belfast, and they couldn't find any evidence of an effect on the carcass weight or conformation, fat classification, daily live weight gain, diarrhea index, or welfare score. So the jury's still out on that, but it seems to be that there's very little in the way of production impacts either. But having said that, farmers are convinced that animals improve in condition when they're treated for rumen fluke, and there is only one chemical available or licensed in the UK for that, and that's oxyclosanide. But there's a grumbling story that also treats liver fluke, and most of the farmers haven't tested for that. So there's potential for undiagnosed liver fluke being the cause, and we'll maybe come back to that in a minute too. But really, in terms of what's changed, I mean, one of the things that might seem a bit academic, but it's actually the species identification of the rumen fluke in question. As I said, all the textbooks told us that it was Paramphistome cervi, but I had an honours student that was looking for a project, and I happened to have some specimens that Helen Carty very kindly sent me from SAC. She was wondering what they were, and I just put the student, just said, look, see if you can sequence those and see what they are, presuming they'd be Paramphistome cervi, but they weren't. They were very clearly something else called Calicophoron dobnii. You could argue, well, so what? But that turns out to be the predominant rumen fluke in livestock in continental Europe, and they do think it's pathogenic. In fact, there's a product licensed in most of Europe called Duvistome, which some of you will remember was brought in to the UK under Cascade. But that contains oxyclosanide, and they use it as a rumen fluke treatment. In fact, the name gives it away. Duve is French for fluke, and stome relates to the rumen fluke aspect. So maybe there's something happening here. So, as I say, the active ingredient, oxyclosanide, that I mentioned earlier, is a liver fluke drug in its own right, but it only kills adults. So there's a sort of hidden liver fluke component to this as well that we need to unravel. But interesting, the title there of a recent review there, The Winner Takes It All, the dominance of Calicophoron dobnii. So it's pretty much all over Europe now. The other thing that's changed is the molluscan intermediate host. If you remember at the start, I said all the textbooks talked about aquatic planorbid pond snails being the intermediate host. Well, that's not right either. Another bit of sequencing, and we can take some credit for this as well, revealed that it's actually the little liver fluke snail, Galba truncatula, is also host to rumen fluke in the UK. The Welsh guys at Aberystwyth beat us to it by a couple of months, but we found rumen fluke infection in Galba snails in Scotland as well. And I think Liverpool have found them in England since. So it's no great surprise now when you realise that if it's the same snail they're cycling through, that you find liver fluke and rumen fluke on the same farms and even in the same animals. So in terms of surveillance, what you really asked me to talk about, and I'm very grateful to Rudolf for sharing information here. And if there's any awkward questions, I hope Rudolf can answer them. But I think this is actually numbers of cases going across the years, and the blue line being cattle samples and the green line being sheep. And you can see that the rumen fluke reflects that sort of perfect storm in 2012 and 13, and it has bounced along a fair bit since. It seems to be on a slow decline, but you can never say never. The important thing is the VIDA code 344, because I remember asking Rudolf what exactly counts as a rumen fluke diagnosis, and it's actually adult rumen fluke in the rumen fluke eggs and feces, or immature rumen fluke in the intestine with evidence of parasite damage. So it's a pretty comprehensive diagnosis. So that's the sort of figures we have at the minute. The units are kind of important. I'm grateful to the University of Liverpool, the student who sort of collated this information and reported it in terms of the percent of total submissions. That gives a slightly different take on it. So this is across the most of the UK, so Wales, Scotland, and England. And you can see that the green bars are rumen fluke and the blue bars are liver fluke. So liver fluke is more common in sheep than cattle. You could argue the rumen fluke is more common in cattle than sheep. So there's a few trends going on here. But none of the percentages are particularly high, maybe sort of 4%, 3% in cattle, not really getting much above 1 or 2% in sheep. There has been a general increase in prevalence over that past 10, 12 years that we talked about, but it's not been reflected, and it's certainly not in the number of sort of clinical cases reported to VIDA. And Rudolf, give me a quick driving lesson on your excellent surveillance dashboards, and there's all sorts of ways to cut this sort of information up. But just a quick snapshot of 2023, which is obviously not a complete year's data. You can see there were 12 cases, in this case, in sheep across mainland GB, and they tend to be sort of the northwest or sort of Cumbria or the southwest of Wales, and that's very typical of where you'd find liver fluke as well in a bad year. So there's no great surprise there. And the same sort of thing in cattle. There were more diagnoses in 2023 to date in cattle than in sheep, and that's sort of the trend extending up into fluke central, sort of around Argyll in the southwest of Scotland. So yeah, no great surprises there, but it's really interesting to see that officially reported. I thought it might be worth a wee look west, actually, to what you might affectionately known as Fluke Central. So these are reports for the island of Ireland. So it includes Northern Ireland AFBI data with data from the Department of Agriculture and Marine in the Republic. So the top bars are liver fluke sedimentation results, the ones on the left being cattle, the ones on the right being sheep. The interesting ones are on the bottom is rumen fluke sedimentations. And again, I'm not altogether sure what they mean by percentage of positive results, but I think the bluey green bars mean the percentage of the samples submitted for fecal egg counts that are actually positive for whatever species of fluke it is in whichever host. And the takeaway message is that the 2021 average percentage egg count positive for rumen fluke were about 27% for cattle and 21% for sheep, so a good bit higher than mainland GB and UK. And that rumen fluke was more prevalent than liver fluke in both cattle and sheep. The liver fluke was down at 2% and 7%. So maybe just looking west, this is maybe where we might be in a few years' time, because our scenario is slightly different at the moment. And just to finally end up with what's sort of happening on the ground, the snails are a really important part of this, as you'll appreciate. We found a very small percentage of galbus snails infected with both, typically less than 1%. You don't tend to find big percentages anyway, but it's interesting that a small proportion of those have potentially got both in. There's evidence of rumen fluke taking over from liver fluke in snails in France over the last 30 years. That's a very clear trend published. And actually preliminary evidence from a University of Liverpool PhD would suggest something similar is happening here. We've got liver fluke at about 1 to 2% in the snails, but rumen fluke in about 9 to 10%. So maybe this is a case of watch this space or watch those snails. So just to kind of finish up, I think the key part of all this, and I know Rumen Health and Welfare Group and the Scops Group and Cows Group are very keen to get the message right on this. And it's very easy to be distracted and say, well, this must be something new. This is something we've got to treat. Rumen fluke eggs are becoming a very common finding in fecal samples. And as we encourage people to do more sampling through national testing programs, we'll find more rumen fluke. But confirmed reports of disease associated with rumen fluke are rare. It's only the immatures, and it's rare at that. Anecdotal reports of stock improving following oxyclosinide treatment, but there's no concurrent liver fluke diagnosis, so that's something we need to sort out. But the epidemiology of rumen fluke is changing, but there's still no evidence that it's getting more pathogenic. But you can never say never, and we need to keep an eye on that. So just to finish up, you'll be familiar with the Scops and Cows group. We've actually submitted a letter to the Vet Record, I think as recently as last week, just to try and put things in perspective, that liver fluke is by far the more pathogenic parasite. And the message is to test before you treat. And you wouldn't treat on the basis of a rumen fluke egg count, because that potentially increases selection pressure for resistance on the parasite populations. We only have one drug that can kill rumen fluke in the UK. And it's a member of a family, the salicylanilides that you'll know closantel rifoxamide are part of as well. So lashing around lots of oxyclosinide is not a good idea going forward. So that's kind of where we want to leave things. And I'd just like to thank Rudolf for the invitation and all his help, with Bob Hanna and Diana Williams for sending information as well. And leave it there.